There are three things in the treatment of multiple sclerosis. Three things, or rather three approaches to treatment. And we need to apply these three approaches correctly. The first approach, in treating multiple sclerosis, when we encounter a patient having a relapse, the first thing we need to do is stop the inflammatory process. Stop the inflammatory process. Second point, we need to restore the lost neurological functions. And the third option, repairing the immune system to prevent future relapses. Three approaches to treating multiple sclerosis. Let's go through them one by one. First, stop the inflammatory process by any means, in any way possible. Well, usually when, let's say, a person gets sick, their arm or leg becomes weak. Most often one side of the body, numbness appears, there's some unsteadiness when walking, some vision problems arise. In other words, an autoimmune inflammatory process has started. I'll tell you right away the reason for this. Well, this is coming from an old neurologist who knows everything about this disease. The cause is hypothermia, stress, some kind of nervous overstrain, and most often it's hypothermia because the autoimmune process is always linked to poor kidney function and poor adrenal function. They are located on the same energy meridian, and essentially cold feet are affected that prevents the kidneys and adrenal glands from functioning properly. And it is precisely this that triggers the autoimmune process. This is what initiates autoimmune inflammation. And this symptom I observe in absolutely all patients with multiple sclerosis. They all have cold feet. They have overcooled cold feet. So, for example, a person catches a cold, gets chilled, but catching a cold with multiple sclerosis is absolutely forbidden. Keep this in mind. So, a person catches a cold, gets chilled, and then develops an autoimmune inflammatory process in the nervous system. Neurological symptoms appear. First, we urgently need to stop the inflammatory process. If you just leave the person as is, there are two possibilities. Either the inflammatory process will stop on its own, since our body does produce anti-inflammatory hormones, and sometimes the inflammation resolves by itself, though this is less common, or the symptoms will persist. And then these neurological symptoms persist. Paralysis can remain for a long time, sometimes even permanently. That's why you can't just leave it like that. So we stop the inflammatory process. Anti-inflammatory medications. Anti-inflammatory medications are divided into two categories. Non-steroidal like diclofenac, the same analgin, acetyl salicylic acid non-steroidal, which are mild or steroidal. Steroidal ones are analogs of our adrenal hormones. These include hydrocortisone and cortisol. Cortisol hydrocortisone is its analog, you see. That's where it all started. Then came dexamethasone, prednisolone, methylated prednisolone, methylprednisolone, metipred, solumedrol, and similar drugs. Massive doses. Well, from the experience of a neurologist, massive doses. Well, when it comes to drug dosages, there's a therapeutic dose, a toxic dose, a sublethal dose, and a lethal dose. Here, even considering that it might be a toxic dose, of course, not sublethal, but you see it's the maximum dose, pulse therapy with hydrocortisone, glucocorticosteroids. These are adrenal hormones. Pulse therapy lasts 3 to 4 days. Keep in mind, as soon as you administer these drugs, the inflammatory process will stop no matter what, but the adrenal gland will be suppressed. So you can't use them for a long time. Long-term use is not allowed. There are specific rules for their use. They are only administered in the morning, because the adrenal gland is active in the morning. That's its biological time to function. But it's important to understand that after pulse hormone therapy, there should be a prolonged period during which hormones are still prescribed with a gradual reduction in dosage. And of course, this will slightly improve the condition of the adrenal gland itself, which was suppressed and stopped from functioning by the pulse therapy. But guys, we have no choice. This is done for vital indications to stop the inflammatory process. And do not expect that you will immediately restore or stop the inflammatory process and that your lost functions will be restored. There's no way they'll recover. No, stopping the inflammatory process does not mean stopping the neurological symptoms. So he stopped walking. They gave him pulse therapy, after which he stood up and started walking. No, that won't happen. Don't rush. Recovery will take time. But the first point is to stop the inflammatory process if we are in a state of exacerbation. Second, let's put it this way. Second, we need to restore the lost functions. Restore the lost functions. That is, once we've gone through this pulse therapy, after about a week, we gradually start to restore the affected nerve. I'll say right away, if recovery happens quickly, the myelin sheath heals and no problems remain. If recovery doesn't happen quickly, a scar forms at the site of inflammation, just like on the skin after an injury. And where there's a scar, conductivity will either be reduced or absent. And then the neurological symptoms will remain. That's why neurological impairments need to be treated thoroughly all the way to full recovery. Don't cut corners on this, because if neurological impairments remain, they can last for the rest of your life. That's why, starting from the second week of treatment, after stopping pulse therapy and switching to prolonged hormone use, we begin nerve recovery. How can we restore nerves? Guys, when it comes to nerve recovery, you have two options: medication and physiotherapy. The primary medication option for effective nerve recovery is, well, let's put it this way. It is indeed Prozarin. Prozarin stands as the initial and foundational drug within this particular therapeutic group. These are specifically anticholinesterase drugs, which are essential medications that significantly improve nerve conduction pharmacologically, thereby aiding in the restoration of proper nerve function. But I don't treat people with Prozarin. Come on. This drug is 60, 70, maybe even 100 years old. I don't know. Of course not. We're in the 21st century after all. There are modern drugs with the same effect as anticholinesterase drugs, but by inhibiting cholinesterase, they improve conduction in the nerve synapse, they enhance nerve conduction. This is exactly what is needed pharmacologically. Some people recommend B vitamins. Honestly, as a neurologist, I haven't seen any good results from using them, either separately or in combination. There are also some general tonics for the nerves, which we always prescribe for the circulatory encephalopathy. That's standard. That's always done, but don't expect it to actually restore the nerve. And I approach nerve recovery in a different way. Nerve recovery involves acting on the nerve with electrical impulses. It's called electrostimulation, or as we call it, myostimulation. When myostimulation is applied to the skin, it affects the nerve and stimulates an increase in nerve conductivity. Is your leg not moving well? Apply myostimulation to the leg. Is your arm not moving well? Apply myostimulation to the arm and spine, to the leg and spine, to the neck area, to the arm. In other words, myostimulation works to restore conductivity in the nerve at the spot where we place the electrodes. And myostimulation, electrostimulation, this is what I, as a neurologist, use to restore nerves. This is the so-called second stage of treatment, the second direction in the treatment of multiple sclerosis. Whatever we can restore, we will restore. It all depends on the effort the person puts in. Of course, this also includes spinal treatments, massages, physical therapy, various types of traction, similar warming procedures, warm tourmaline mats, and everything else. All of this, yes, all of this is necessary, all of this is good, but specifically for nerve recovery, for restoring the nerve, its electromyostimulation, the effect on nerve conductors using low-frequency electrical impulses. And then, whatever we manage to restore, we restore. Don't think it will be quick, but it works, and it always works. That is, I measure the electrical conductivity of the nerve. Electroneuromyography, that's the word I was looking for. I measure the nerve conductivity. The nerve conductivity is around 60%. I prescribe a course of 21 days of electroneuromyostimulation, meaning the use of a myostimulator. Upon retesting, it's 70%. So in 21 sessions, 3 weeks recovery improved by 10%. That's an excellent result. Really great. Really great. So should you continue? Yes, of course. What's stopping you from doing another 20 sessions? And even if it adds just 5 or 7% more, it all depends on the person. I'm not even talking about physical therapy, massages, and everything else. That's all your own effort. But it works. And then, however much progress you make, that's what you achieve. And now, The third point, and now the third and most important point. How do you repair the immune system so that there are no further flare-ups? And here, there are two directions. First, there are medicinal mechanisms for regulating immunity, medicinal options for repairing the immune system. These are immunomodulatory drugs. Immunomodulatory drugs, there are a lot of them now. In a way, I was somewhat lucky. I worked a little with these drugs for a while. And I'll tell you right away, the effect is practically zero. The effect is practically zero. Various beta interferons, alpha interferons, rabies, betaferon. I especially like latiramer acetate, which is now heavily advertised as Copaxone. Honestly, I don't even want to name all the drugs. Guys, the person has a real neurological deficit. They have some neurological impairments, and they prescribe Copaxone, which is extremely expensive, but Copaxone is for treatment. Are you out of your mind? Do you even understand what kind of disease this is? These are drugs meant to repair the immune system, to prevent the next exacerbation. The result of treatment with these drugs is the absence of further exacerbations. Judged by that, people tell me, I started taking Copaxone, but there was no recovery at all. But it's not supposed to do that. These drugs are aimed at repairing the immune system in order to restore immunity and stop the autoimmune process so that there won't be another exacerbation. If you're having an active exacerbation, suppress it with steroids until it completely stops. If neurological symptoms remain, restore nerve conduction. But these drugs are only for repairing the immune system and preventing recurring inflammatory processes, recurring exacerbations. That's all. Well, I understand that these won't give you results. The cause of autoimmune processes is poor functioning of the kidneys and adrenal glands. The kidneys and adrenal glands. If you want to avoid inflammation, recurring exacerbations, keep your body warm. Keep your body warm. All flare-ups are caused by hypothermia, sometimes by stress, by overstraining the nervous system. Overworking, this happens too, so take care of your nervous system as well. But first and foremost, take care of your kidneys and adrenal glands. For the kidneys, besides warmth, there's another important factor. Please drink plenty of water. Yes, there can be problems with the pelvic organs. By the way, this can also be restored with the same myostimulation. But if you don't drink water, your kidneys won't cleanse you properly, and another autoimmune flare-up is inevitable. So drink water according to your body weight. For every 30 kilograms of body weight, drink 1 liter per day. And the second thing, we need warmth. And here you can't avoid using equipment like Turmenium ceramic. What I'm showing you is a Turmenium mat, the smallest and cheapest one, but it works. And I need this material, which is called Turmenium ceramic. Why? Because when heated, it gives off the same warmth as my own body heat. And it's safe, and it effectively warms me up. And with the Turmenium mat, we warm the kidneys, just lie on the mat. We warm the lower abdomen, cover yourself with the mat. And most importantly, we warm the legs. By legs, I mean the shins and thighs. Place yourself on the mat, cover up, wrap up, and warm your legs. And your future health, the absence of flare-ups in the future, depends on whether you've warmed up your legs or not. You don't need Copaxone, you just need to warm up your legs. Alright, you've been outside, you caught a chill, you got cold. What do we do? Guys, when you get home, immediately warm up your legs. Immediately warm up your legs. Because tomorrow you'll have a flare-up if you don't warm up your legs right now. That's how it is. That's just how it is. You need to warm up your legs. And you should keep your head cool, that is, stay stress-free, be a calm person, and keep your feet warm. That's the solution to preventing future flare-ups in multiple sclerosis. Yes, that's your prevention. That's what you need to repair your immune system. And then your kidneys will function properly, and your adrenal glands will work well too. But for the adrenal glands, another important factor is your daily routine. The adrenal gland is an early bird. It's a lark. It wakes up at 6 in the morning, no matter when you wake up. So if you wake up at 8 or 9, your adrenal gland is already asleep. That's it. You've overstepped. That's why having a routine is vital for your adrenal glands. waking up early in the morning at 5:30 at the latest, by 6, and doing it in a way that triggers stress so that a bit of adrenaline is released from the adrenal glands. A bit of exercise, a routine, proper morning nutrition, breakfast, and an active lifestyle. Physical activity, not just using your brain at the computer, but actual physical activity. That's the kind of routine that will give your adrenal glands a good life. So that was the information for you today about the treatment of multiple sclerosis. 2 videos. The previous video is this one. The second video is information from a neurologist, Dr. Golod, for you about a condition called multiple sclerosis. I believe that for many people this video will be vitally helpful in addressing their issues and illnesses. Well, that's the information I had for you today. Thank you for your attention, friends. I'll be waiting for your, let's say, comments about this video and any further questions you might have. Maybe there's something else interesting I should talk about. But for today, I'll say goodbye to you. Thank you for your attention, friends. Goodbye.